This conference will now be recorded.
Hello everyone. Today our topic is brief overview of study designs. This is Dr. Aisha and I hope that I'll be able to give you a brief introduction to different types of the studies. So basically when we do the studies, we have to find a rigorous design. Why? Because it should be able to answer the question that we are asking. What is the question? What is the topic of your article? That is your study question. Okay, so we can frame that in different ways. Once we will cover the basic sessions, then we will go to the scientific writing, and then we'll be discussing the topic selection and how we do that, what are the sources, what are the resources, and how you can find a cool, catchy, and current topic. Any topic which is valid, because you should be researching the things which are being researched in most parts of the world. Why? Because these are hot issues and we are trying to find the answers. So choice of study design, it will depend upon many things. You will have to you will have to strike a balance of pros and cons. It depends upon several key settings. What is your study question actually? Then what are you trying to do or accomplish? So are you going to describe something like you are writing a review article, or you are going to analyze data like you are doing a research article, or you are writing your thesis? So the choice will depend that what is your intention. Are you just going to describe something, or are you going to analyze something? Then what are you trying to measure? Exactly what is that thing? Are you talking about some disease process? Are you looking at the etiological factors? Are you looking at the risk factors? Are you thinking about the strategies to reduce these risk factors? Or are you looking at the current data, whatever information we have with us right now, and then in the light of that one, you are going and searching for the newer evidence? Or maybe you are trying to write a review article on the contemporary treatments of some type of cancer, or like I would say that diabetes is more common, so maybe you're going to look at the diabetes, and you can see do so many different things on one topic. Like you can do the topic of this controlling the risk factors in the diabetics for development of diabetes, or managing the diabetes effectively, or you may look at the long-term effects of the diabetes, many things. Similarly, I will give you example of the information technology, like you are setting up a company which is going to sell the data products. So when you want to do that, you will like to do your homework. First, you will try to see that what items are available and is it feasible for you to sell them or not. So you will do your groundwork, you will do your homework, you will collect all information, and then you will think that are you going to just describe the product so that you will be guiding the people that they should go and buy a certain product, or they should adopt a certain business model for their system, or you are going to analyze that business model. Is that a good model? Is it rewarding? And is there any consumer protection? And are you going to reap some profits, or you're going to face the losses? So you need to analyze the things. So basically, it will depend upon your intent. The choice of study design, it will depend upon your intent. What exactly are you trying to do? What are you trying to measure? Are you trying to measure the number of cases of some disease, like I said, diabetes in a certain population? Or you are going to see that at what stage of disease, like again with reference to the diabetes, the patients, they will develop serious complications of the diabetes, like myocardial infarction, severe hypertension, stroke, peripheral artery disease. Or similarly, what will be the outcome? So you're trying to measure. Or maybe you're trying to measure the exposure and the outcome, that if some person has developed some disease, So you would like to see that has this person been exposed to the risk factors, or we can flip it like some person has been exposed to certain risk factors, and then you are following up with on that person, and you want to see what will be the outcome of this exposure. Among the common examples, I would say like there is radiation exposure. Somebody has undergone this radiological investigations in the start of pregnancy. So we would like to see what happens to the baby, or maybe nothing will happen to the baby. So we are trying to establish causality. What is that? That exposure, it will lead to outcome or the disease. Then who is your target population? How much time do you have? What resources do you have? Do we have plenty of money? Is somebody sponsoring us? Like I told you guys yesterday, that the randomized clinical trials are very expensive. They take long period of time like years or maybe decades. Why? Because you are going to collect data on a larger sample, so the target population is going to be larger. So everything is not for everyone. Like if you are going to look at the, let's say, prevalence rates of hepatitis C virus in any country, then maybe you would want to look at the people who are using the drugs, they are sharing needles, and that is the most common route through which the hepatitis C would spread. Okay, so you would like to go and search in that population that who is having what complications of sharing this IV in these needles, and have they developed hepatitis C infection or they have not. If you will go to some low risk population with the same question, then the chances are that you will not be finding many people who would test positive for hepatitis C virus. Another example would be, suppose you are working in ENT and you want to write an article on, you know, let's say on tonsillitis. So you will go to the children, you will go to the pediatric ward, and you will collect data from there, because the pediatric population is more likely to develop tonsillitis, right, as compared to some adults. So the target population, what is your target population? How much time do you have? Like, can you expand your study, your paper over a period of years, or you need to do that right now? So it will be dictated by what exactly you are doing. PhD students, usually they will have longer periods of time, but keep in mind that they are doing so many experiments before even they reach this point where they will be writing the papers. Like first of all, they have to do like 2 years of the basic studies, which are the prerequisites, and at the same time they are planning their experiences and conducting them. They are collecting data, they are analyzing that data, they are developing their project proposal, and then they are presenting their work to the seniors, that because they will be supervised by a certain committee, they will have a single supervisor who is observing them, and only then you will go to the point of writing the letters, writing the thesis, like that. So it depends that how much time actually you have. So most of you are physicians and working at different levels. So as you know, most of the time you people are busy with the calls, with the night duties, so you people have very little time. If you are a beginner, I would suggest you should go for the retrospective studies, because it's very easy to collect data and to write a good paper. Prospective studies are usually very interesting, but they are time consuming, and you have to follow up on the patients, on the cases. You have to call them, you have to set up a schedule. When are you going to collect data? So it will involve so many different things. Then, what resources do you have? What do we include in the resources? Who is your senior? Maybe a program director, maybe some registrar in some settings, maybe the specialist, or maybe the consultant in some settings, or maybe a senior house officer with you, or it may be a supervisor in your university. But this is an important connection. You should have very good connection with your seniors, and take them on board, and don't give them the details, but tell them that you are looking towards exploring these topics like that. Okay, so they will give you useful advice on it. And then you need to see that do you have access to certain journals. Most of the things you can find for free on the Google search. You can go to the NIH website. There is Higher Education Commission in each country. You can go there and you can search the different journals without even making an account like that. Okay. So these are different resources. Once we will go to the topic selection and the reading the literature, relevant literature, then I will tell you about important connections. Money is also important because if you are asking somebody, like this is your target population, you're asking them to come to the hospital, then obviously they are spending money to reach hospital, maybe their train fare, taxi fare, or maybe they are using their own car, but they are burning gas, so you need to tell them about the money and how much money you have. And this should not be like too much, a large amount of money. So it can be given in the form of gift vouchers, or maybe you can give them food, or maybe you can give them free checkups, or you can give them free medicines. So many things can be there. But if you are giving somebody an expensive vacation, or you are giving them money so that they will publish your article, so that is considered unethical. And other examples, like if you're getting your data analyzed by some experts, usually you have to pay a certain amount of money. It is different in different countries. Like since I deal with many residents, so I have seen them paying as much as 300,000 Pakistani rupees, or maybe 5,000 Saudi riyals, or maybe 13 or $1,400 only for the data analysis. It is such an important thing. It can make or break your study. Okay, why? Because the results you will turn in, they will be analyzed by another expert statistician and a couple of reviewers. They are going to review your paper. So if there is a mistake, it will be it will be caught at that time, and it will be noticed, and then the journal will send your paper back to you for another review. So that's why things should be done in the right way. Okay. And then, do you have staff? Why you need staff when you're doing, and when you're trying to do some research work? You need some people to work with you. If you think that you can do it on your own, you have plenty of time, like you have a month or 2 months on hand, and this is all free time, you have no other commitment. Yes, then you can do it on your own. Especially if you are collecting the retrospective data, then you can do that maybe in a couple of weeks as well, but if you know the techniques like that. Okay. But if you are recruiting your patients or some other people who are working with you, and you are trying to collect data, then you need staff. Why you need staff? Because the staff should, first of all, they should tell the people what exactly you are going to do, what exactly are you trying to achieve. Then they need to take consent from the patient, from the participants, because without consent we cannot take anyone's information. This is also considered an assault. So, or maybe this is a breach of confidentiality. So we cannot access patient records unless we have taken permission from the patient. But this is true if you're writing a case report, case series, or you're trying to gain more information from the patient. So the staff, the nurses, usually they are consenting the patients, or they are also supervising the speed, the way at which you are doing your work, like they are coordinating the activities, and they are also checking that are you sticking to the study protocol or you're not. Okay, so all of these things are important. So one person should be responsible for organizing so many different activities. Like you are going to set up the schedules and you should not be falling behind the schedule. So who is going to supervise that one? A clinical trial coordinator. Similarly, if you need to get the IRB, Institutional Review Board permission, then again you need to have one person for the, then again you need a person for communicating with the IRB. So these are important parts of the study like that. So this is the staff that you should be having at a minimum. So if we look at the different types of the studies, then I would say that the basic types, basically we can divide the studies into two, like the descriptive studies or analytic studies. Mostly the descriptive studies, they examine the distribution of a disease in a population in terms of person, place, and time. Analytic studies, testing, they are used when we are testing a specific hypothesis about the relationship of a disease to a specific cause or a risk factor. So in the descriptive, we are just making certain observations and then we are sharing our experience with others. But in the analytic type of studies, we are going to collect the data and we are going to test basically a hypothesis, and then on the basis of the results of the study we are going to accept or reject this hypothesis. So like I said, descriptive studies and the analytic studies. Descriptive studies, they can be of like three types, like the case reports or the case series. These can be the ecologic studies or cross-section studies. We are going to talk about all of these things in a bit. If we talk about the analytic studies, again, these can be observation studies where we are just going to observe certain things. Or these can be the experimental studies where we are going to test some medicine or device, or we are going to compare the surgical procedures. Okay, many things can be there. So in the descriptive studies, the case reports or case series, then the ecologic studies and the cross-section studies. Cross-section studies, the studies we are doing at a certain point of time. Among the analytic studies, if you are talking about the observation studies, these can be case control studies, these can be cohort studies or cross-sectional. You are saying that how come this is a cross-section study here and then it is analyzed here as well? Yes, actually the cross-section studies, they can be described or they can be analyzed. So like in most of the studies which were done in the COVID pandemic, we have done the cross-sectional studies and we have analyzed the data at the same time. Experimental studies, like I said, like the randomized controlled trials, or we can do the quasi-experimental. Here the difference is that in here we are randomizing the things and the subjects, the population, but here this is done without randomizing the population. What is a scientific rigor? Like how strong is the evidence from these studies? So this is a hierarchical system. Case reports, they fall at the least level of the rigor, like something happened and we have just reported that case. Why? Because this was an exception, or maybe there is something to learn for everyone. Case series, when we are describing like 4, 5, 6 or any number of cases, the people having the same type of disease or issue. Ecologic studies, when you are talking about a certain area or a certain population, like I will give you the example, like we said that in a certain city the number of the people becoming sick after drinking water from a certain lake, it has increased, like they are becoming sick, they are developing this bloating, diarrhea. Why? Because maybe this water contains giardia. Maybe that's why the people are becoming sick, they are having abdominal bloating, pain, diarrhea, like that. Okay. So when you are looking at a city level and you're collecting this data at the group level, then you are doing the ecologic studies. Here you can also compare that what were the stats in a city at 5 years ago and what are the statistics now. Then the cross-section studies, like you are collecting data at a certain point of time, and then we are only observing it or we are analyzing it. Then come the case control studies, then the cohort, and then the clinical trials. So the highest level of evidence or the most rigorous of all of these things would be this studies would be clinical trials, and then cohort. And remember that this is an experimental study. This cannot be experimental. This cannot be like observation. Okay, this is an experimental study. The rest of the things, yes, they are observational studies. Then, descriptive epidemiological studies. What are the key features of the descriptive studies? So, these essential features of descriptive, three essential features of descriptive studies include the person. Who are we interested in? Like this population of interest or study population. Are we interested in the individuals or groups of certain people with certain characteristics? Like what is the age group, what sex we are interested in, because certain disorders are more common in the females and some other disorders they are more common in the male. Then are we looking at the racial and the ethnic status, etc.? So this is the demographic information. So first thing is person, second thing is place. Where is the outcome occurring? Like you need to tell them what is the geographic location of that country or that city. So you need to tell them what is the latitude and longitude where these places are located. Certain problems are more common in the hot, humid environments, and certain problems are more common in the colder areas of the world. So the climate, the diet, the environment, so many things would come into play. Then time. When is the outcome occurring? The outcome after the exposure, it is occurring in years, in days, or this is something seasonal. So these things like the time, place, and the person, these are very important. They are very helpful in choosing the correct study design. So basically, if you are looking at these things, time, place, and person, and you're trying to establish the relationship between the disease and between the exposure and the outcome of interest, then you would like to go for the descriptive epidemiological studies. What are the different uses of descriptive studies? When you want to evaluate trends in the health and disease, and these studies they will allow you comparisons. So comparisons among populations and subpopulations. So basically, if you want to analyze the trend of a disease, then you should be looking at the descriptive studies. You will also use a descriptive study designs if you're trying to provide a basis for planning, provision, and evaluation of the services. Like the healthcare planning, it will be like in a year or 5 year plan or 10 year plan. Depends that where you are working and what type of planning you are doing. Descriptive studies are also used to identify problems to be studied by analytical method and to test hypotheses related to these problems. So if you want to generate a hypothesis for a larger study, then again you will go for the descriptive studies. So the common examples of the descriptive questions are that who gets sick and who doesn't, and then what are the rates of the disease, where are rates of disease highest and the lowest. Like we said that the COVID-19 infection was more said to be more common in the people who were immunocompromised or who were diabetics as compared to the people who had normal blood sugar levels and whose overall health was better. Then what are the patterns of disease? Like this is just one time issue, or this is an acute disease. It is recurrent like the seasonal flu, or this is like an acute issue. Then what is the prevalence of disease in an area? So if the prevalence is very low, then what is the point in doing the study? Okay, so then you will be just using a descriptive another design. So the descriptive studies, you can also divide them on the basis of the level of the data that you're going to collect. If you are looking at the group level data, then you will go for the ecologic or the correlation studies. If you are collecting you do have this individual level data, then you can write a case report. Or if you have data on more cases with the same disease, then you can write a case series. So all of the cases in the series, they should be having the same disease. Or maybe you can do cross-sectional study. So like I said that if you have group level data, you would like to do ecologic studies or correlational studies. So these studies, they use measures that represent characteristics of entire population or the groups to describe the outcome. And we use groups or aggregate level data rather than the data on the individuals. And the units of analysis is often like the countries. Why? Because we are getting the data at the group level. And these groups are not smaller groups, these are the larger groups. So maybe at the level of the countries, regions, states, cities, provinces, depends that where you are living. Example will be like what are the dietary habits if the people are taking more and more carbohydrate, then what is the incidence of developing certain other problems? Like if you're taking like plenty of carbohydrates, are these people going to develop other metabolic syndromes or not like that? Okay, so it will depend upon so many different things.
This conference will now be recorded.
Like you said that at the group level data, if the example would be if the people are consuming a lot of carbohydrates, then what is the incidence of diabetes in the countries? Like one third population of the world is right now pre-diabetic or diabetic. So you would want to see that what are the dietary sources of these people, how we can modify, because the prevention you are going to offer, that would be at different levels. Okay, so you can help them. Then there can be ecological studies. The ecological studies, again, we are collecting data at the group level. So what are the advantages? Again, this type of studies, like you're collecting data that what is the prevalence of a certain disease in a certain population, like at the level of the city or at the level of the country, even at the level of the continent. So these studies can be used to generate hypotheses for analytic studies, and they have lower cost and they are quicker because you are just looking at the statistics which are available on the departmental websites, then association with community level characteristics. So then there are certain limitations of ecological studies, like they cannot say anything about relationship about the disease and the exposure in the individuals, and they cannot be used to determine dose response relationship for individual level exposures, and there can be confounding bias should can be there, and the caution not to make inappropriate conclusion, because if we make inappropriate conclusion from the ecological studies like the surveys, then we call it ecological fallacy. So the case report means detailed presentation of a single case. Generally, it will report a new or unique finding. Examples would be like unexpected link between diseases. Like this is just a sudden finding. You will say that I have seen a patient who had very high blood sugar levels, and then this patient developed heart attack, myocardial infarction at a very young age, at a very younger age, because you know that if you have somebody has diabetes, they are very much likely to develop long-term complications of the disease, which we expect to see 10 years after the diagnosis. Okay, so maybe there is something new which you were not expecting to see, but there is this disease now. So you will look at the risk factors in the patient, that what exactly she or he had and why she has developed a certain disease. Then there can be unexpected new therapeutic effect. Like, I will give you one example. This misoprostol. So H1 blocker. It was used for the people who had gastritis, acidity, but it was found that the women who were pregnant at that time and they received misoprostol, they ended up having miscarriage in the first trimester, in the second trimester, like that. Okay, so that was totally an unexpected finding. So later, the FIGO it made different protocols, and now this drug is used for the treatment of different problems in the females. Then maybe we gave some patient received a drug and you observed some adverse event and you don't want other people to suffer from the same side effect, so you are going to report this adverse event, and then people will like to be more cautious in using that drug. Case series, these are the case series. They will report group of individuals with the same diagnosis, and cases may be identified from a single or multiple sources. Like, it is not necessary that all the cases would be occurring in your hospital. Maybe you have read a report about a certain problem in your hospital, then maybe from another city that somebody has reported a similar case, or maybe somebody in another country has reported the same thing, and now you're developing the link between the cases. So generally it is used to report on new or unique conditions, and it may be the only realistic design for the extremely rare disorders. That's why I said that the cases may be occurring in certain area of the world, in one country, then another country, and then yet in another country. So we are just getting a case series. One example would be like the people are using sunblocks. So maybe somebody has developed this skin cancer even after using a certain sunblock. So it means that this sunblock, maybe it was not very effective. So that's why it didn't block the harmful rays causing harm to the individual. Or maybe the individual did not use it appropriately. Or maybe the environment in which that particular individual was, there the rays were stronger and maybe he needed more protection. So many different variants could be there. So basically, we are going to collect a lot of information on these things. So what are the advantages of case reports and case series? These are useful for hypothesis generation, and they are informative for rare diseases with few cases. So few cases, like the when they were controlling the smallpox. So after that, if the cases were reported, then discussion was taken around them that why these people are developing, because this smallpox has been eradicated from the world in 1973. That is the reason. So, what are the limitations of case reports and case series? They cannot study cause and effect relationship between the exposure and the outcome or development of a certain disease. Some people they would be exposed to the risk factors and develop disease, and some people they would have history of exposure to the same agents but they didn't develop disease. So, what was the difference between the first group who developed the disease after exposure and this group in which the individuals have not developed disease after exposure? So, there is no temporality. They cannot assess disease frequency, and this is the least rigorous of the study designs. And there would be no comparison group. This is just an observational descriptive study. So the next type of descriptive studies is cross-section study. So this is an observational study that surveys exposures and disease status at a single point in time. So that's why we say at a cross-section of the population. Like, this is a certain population at a certain time, and this study was done here. So we can say that this cross-section study was done at this point of time, and at that time This was our observation, single point in time. Okay, we are not observing the subjects over a period of time or for multiple times. So the cross-sectional study designs we can use in several ways. Like we said that the study exists at only this point, at a single point of time. So what is your study population? Like the people who have no disease and the people who have developed a certain disease. If the patients they have no disease, then we would like to see that do they have the risk factor is present or it is not present. Risk factor is present or the risk factor is absent. So we are getting full information that this person is healthy, he has no disease, but does he have any risk factors or the risk factors are absent. Then the people who have developed a certain disease, you would want to see that the risk factor is present or the risk factor is absent. Why? Because we need to establish the ground realities. Why this person developed disease and why this one didn't develop disease. So what are the advantages of cross-sectional studies? So they cut across the general population and not simply those seeking the medical care. So it is a reflection of the population where the study is being done. These studies are good for identifying the prevalence of common outcomes. What is the prevalence? That how many people with a certain disease are living in that population. Cross-sectional studies can also be used to generate hypotheses for analytic studies. Their cost is low and they are quick. So then what are the disadvantages of cross-sectional studies? This is the weakest observational design, cannot measure the incidence of the disease. Incidence is the new cases of a certain disease. This type of studies, they cannot determine temporal sequence of exposure and effect, causality. Does the exposure cause the disease or it doesn't? These are not good for studying rare or highly fatal diseases or those with short incubation period. Why? Because usually they will not give you information on the incidence of the disease when the disease occurred like that. Okay, what happened? So they are just telling you about the prevalence, that how many people with a certain disease or the risk factor are present in a society. So these are good for if you're looking at the prevalence of a disease. So descriptive studies in general, they share the characteristics like no cause or effect relationship. These are just associations. And some researchers they try to overstate their findings. Why? Because there is no control group. So they can just go on talking about the benefits of a certain intervention. So, like in 2005, it was observed in certain populations that the females who were using a certain type of contraception which contained drospirenone, several cases were reported that they have developed blood clots on their leg veins. Some cases of deep venous thrombosis were reported. And the authors they made certain claims that these drugs are very high risk and the females they are going to develop blood clots very easily. So what was the end result? The females they stopped taking the drugs which contained drospirenone. This is just one of the trade names, but the drug was drospirenone. So it would have resulted in so many unplanned pregnancies. In the next session, we are going to talk about the other study types like the case control design, cohort studies, randomized control trials, meta-analysis, and systematic reviews. So thank you for attending the class, and those who are not present, it's their choice. But if you're really looking towards publishing an article, you should understand the basics of the study, then can go to the other things which are also very important. Okay, so take just like baby steps, you need to go step by step. So you should have good understanding of the subject, and then we can go and do other things. So thank you very much for attending. See you tomorrow. Bye.